Yeah, I'm Dr. Thomas Sough. I'm a consultant orthopedic surgeon at AIC-Cure International Hospital, Kijabe. I specialize in pediatric orthopedics, and that is exactly what we do at AIC-Cure International Hospital. The conditions that, as the word entails, they are not common. They affect a few people. And many of those conditions, even some orthopedic surgeons may end up, or doctors may end up not seeing them in their lifetime. But others, we see them just because they concentrate in certain areas, and because of their own, the nature of the practice they have, they may end up seeing more rare conditions than others. Take, for instance, in orthopedic practice, as a pediatric orthopedic surgeon, certain conditions like congenital pseudarthrosis of the tibia is uncommon, but because we are pediatric orthopedic surgeons, we see them commonly because they are referred to us from different parts of the country and even the world, and therefore we see them regularly. Many other conditions too may be rare, but some doctors may be privileged to see them more regularly than others just because they have some level of practice involved such rare conditions. Many of the rare conditions don't have definite causes and all that, especially like the pseudarthrosis I've mentioned. The cause is not so well understood, but there are factors that lead to pseudarthrosis. And as I've said, it's a congenital problem. That means it starts even before the child is born, and it continues into the life of the child. There may be problems that affect the bone, especially the covering of the bone we call the periosteum. And the bone itself, because of excessive resorption of the bone and there's no commensurate bone formation, then you have weakening of such bones, and that predisposes the bones to deformities and also fractures. And that's why when you see these patients, they have deformities, which we call an anterolateral bowing of the tibia, and in some cases, fractures that refuse to heal, or fractures that will never heal on their own, except if you intervene in one way or the other. And as orthopedic surgeons, we usually, have to operate these patients. But I must also tell you that even taking care of them is quite challenging because of the nature of the pathology that these children come down with, and the condition itself is. And therefore, it is a condition that is actually embarrasses many orthopedic surgeons, because even when care is taken and fully of them, you still have other things that come up, like refracturing of the bones, and sometimes some children may end up having several surgeries, and they end up having amputation if such surgeries will not give the desired results. Congenital pseudarthrosis of the tibia is a diagnosis that is not so difficult to make, because it presents in a typical way that a trained orthopedic surgeon will know that, yes, if he sees it, he will know that he's dealing with a congenital pseudarthrosis. And so, if such signs are there, and he does X-ray to be able to know, so that he will differentiate them from other, conditions, they usually, because of the deformities that they come up with, and the association of other disease that may come as a result of, this condition, especially neurofibromatosis type 1, which is in 50 to 60% of cases of pseudarthrosis of the tibia. These patients have neurofibromatosis. And therefore, you see other signs of that neurofibromatosis on the patient itself. So even if you are in doubt of what it is exactly, when you see some of these signs, you will know that, yes, you are dealing with a case of pseudarthrosis. But as I've said, the diagnosis is usually not so difficult to make and all that. So early detection of this disease is possible for the orthopedic surgeons. The condition is commoner in a single leg. When it occurs in both legs, I have not even seen one occur in both legs. So it's extremely rare to occur in both legs. But in that one leg, there is usually a deformity, which is a kind of a ball leg deformity, which instead of the usual ball leg we talk about bowing from the outer side of the bone, it bows from the anterior, which is facing forward, right? Will I say? So the tibia bows from, the anterior aspect, and then you could have also the deformities around the ankle. Sometimes they will mimic clawfoot deformities and all that. And obviously, there is a fracture. For some, there is just a deformity. But for others, there is a fracture with severe deformities. And others will also have some constrictions around the area of the fracture. And sometimes, if these patients are not, the condition is not addressed in these patients early enough, you meet them in later childhood life, and at that time, you have the limb is shorter, obviously shorter, apart from the deformity that they have, it is shorter than the normal limb. So all of these are, signs that you will know that you are dealing with this condition. And then, as I've said too, it's association with neurofibromatosis type 1. You will see there is something we call cafe au lait, which are just like, they appear like birthmarks. They are brown in color. That cafe au lait is a French terminology that indicates the color of coffee. So you can have like coffee ground patches on the skin of such a patient. It's quite typical, and some may have other manifestations of neurofibromatosis. So in a nutshell, the deformity affects the tibia or the leg, will I say, the bones of the leg, the tibia and the fibula. And usually there is a forward deformity of these bones. The bones bow backward, and sometimes, obviously, as I've said, you have a deformity of the ankle and the foot too in association. And the limb is shorter in association with that deformity. Anytime you see these patients, especially those that were not initially diagnosed early, or they are neglected at the time of birth, and they are seen in later childhood. when you talk about rare conditions, many people do not have sufficient knowledge even to be able to identify these conditions, and then there is no sufficient knowledge to be able to take care of them well. Well, in the case of congenital pseudarthrosis, it is challenging, but right now, as I speak, there are a lot of studies concerning this condition that has embarrassed a lot of orthopedic surgeons, and I think it has, we have had successes in some of managing some of these cases, especially as scientific studies have continued to pour out as a result of the challenges that face the orthopedic surgeon in managing them. So I can tell you that it is not easy to live with them. In my opening statement, I told you that some of these patients will end up having many surgeries, and then if those surgeries do not come out successful, they end up having amputation. But I think with the advent of scientific knowledge of this over time, there are right now some processes that we take to be able to make sure that the condition is treated properly, and we give these children a good quality of life as they live. But as I've told you, financially, it is quite demanding. It is quite demanding psychologically. It's quite demanding all around. So in a nutshell, it is not an easy condition to take care of, because you have to really, really have the financial muscles to be able to even go through all these surgeries that I've talked about. And also, it is not a condition that a fracture occurs, and we usually put cast to be able to, spleen the fractures in children for them to heal. And most often than not, fractures in children heal without any problem. But for this particular type of condition, when fractures persist, because of the pathological, nature of that fracture, they don't heal with simple splint. And even with simple surgeries, they don't heal until you deploy advanced level, mode of treatment, which have now been in place to be able to take care of them. So if you're talking in terms of the challenges of living with them, I can tell you that it's quite challenging. It's quite challenging for the parents and for the patients that are, suffering this condition. My name is Dr. Thomas Sough, the Pediatric Orthopedic Surgeon in AIC-Cure International Hospital in Kijabe here in Kenya. It is not all, gloomy. If you have a child who has congenital pseudarthrosis of the tibia, we want you to bring the child to us, and I can tell you that with the knowledge we have now of this rare condition, we'll be able to take care of that child and give that child higher quality of life. Thank you very much.